Yeah. Coronary circulation. Okay, so the coronary artery are the predominant blood supply to the heart. Okay, so this is MCQ. Okay, and this coronary artery arise from the sinus of valsalva. Okay, and they are the first arterial branch of the aorta. Okay, one liner given just CABG still remains the most effective treatment for coronary artery disease and most commonly performed open cardiac procedure. Okay, CABG most common treatment for most effective treatment for coronary artery disease, and it is most commonly performed open cardiac procedure. Okay, open. We will explain this picture bit later. First we will understand theory part. Okay, so this coronary artery further divided into left coronary artery and right coronary artery. Okay, so left coronary artery is arise from the left coronary sinus. Okay, and this is located posteriorly, and the right coronary artery arises from right coronary sinus and it is located anteriorly. Okay, so left is posterior and right is anterior. Okay, now come to left coronary artery. So it is also known as left main coronary artery. Okay, so left coronary artery or left main coronary artery. Okay, so its length is around 2 to 3 centimeter. You can remember 3 centimeter LCA. So 3 centimeter. Okay, after course of 3 centimeter. Okay, so it divide into usually 2 branch, sometimes 3 branch. Okay, so split into left anterior descending and left circumflex artery. Okay, and sometimes as a ramus intermedius. We'll explain this later. Okay, first understand if it is divided into 2 parts. Okay, so if it is divided into 2 parts. Okay, so this left this now first understand the left anterior descending, the main branch of the left anterior left coronary uh, left main coronary artery. Okay, so left anterior descending runs anteriorly. Okay, okay, in interventricular septum. So left anterior descending artery runs between the two ventricle. Okay, interventricular septum. Okay, so there are 3 septum. Okay, you understand the one septum between the ventricle and upper septum between the atrium and ventricle. Okay, so in atrium, in the right side, this atrioventricular septum runs the right coronary artery. In the left side of atrioventricular septum runs circumflex artery. Okay, we'll explain further. It will clear more on subsequent discussion. Okay, so this LAD runs anteriorly over interventricular septum. Okay, and it give the 2 branch. This LAD, this one is diagonal branch from diagonal branch. Okay, so this is asked diagonal branch. Okay, and then and this diagonal branch supply anterolateral wall of left ventricle. Okay, okay, this line is not that important, but at least you should know that diagonal branch comes from LAD. Okay, the LAD is most important surgical vessel because it supplies more than 50% of LV mass and most of the interventricular septum. So this line is important. Okay, so and since it is supplying, it is going through the septum, interventricular septum, so it give the septal perforating branch also. Okay, okay, and finally that LAD going up to the apex of the heart where it anastomosis with posterior descending artery, that is the branch from the right coronary artery. So at the apex of the heart, this LAD meets with posterior descending branch. Okay, that is the mirror branch from the right coronary system. Okay, so left anterior descending from the left side and the posterior descending branch from the right coronary system. Okay, okay, now come to the circumflex artery, that is the second branch of the left coronary artery. Okay, this runs into the atrioventricular groove. Okay, and it gives the obtuse marginal branch. Okay, important, this obtuse word is important. Okay, and the third, and it's not always present, that ramus intermediate, it arises occasionally from trifurcation of left coronary artery. Remember, if left coronary artery trifurcates, it gives ramus intermediate. Okay, okay, and it is intramyocardial, and so it is difficult to locate. Okay, it's inside the myocardium, so it is difficult to locate. Okay, now come to the right coronary artery. Okay, so right coronary supply most of the right ventricle as well as posterior part of the left ventricle. So they will ask, posterior part of the left ventricle is supplied by mainly via the right coronary artery. Okay, so, and this right coronary artery runs in the right AV groove. In the left side of AV groove runs the circumflex, left circumflex artery. Okay. 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 So this right coronary artery bifurcate into two branches, the posterior descending artery and right posterolateral artery. So right posterolateral, right is already there, so no need to remember. This PDA, posterior descending artery, is important, and it's branch from right coronary artery. Remember that. Okay, and this also give, RCA also give acute marginal branch. So acute marginal branch from RCA, obtuse marginal branch from circumflex artery. Remember that. Okay, acute and obtuse. So PDA, posterior descending arising, sometimes that PDA arises from both RCA and LCA. So in that condition, it is known as codominant. Okay, or codominance. Okay, remember. So AV node artery mainly comes from RCA in 90% of the patient, important, and the SA node artery comes from RCA in 50% of the patient. Mainly they ask about AV node. AV node is supplied from RCA. Okay, okay. So the source of PDA is often used clinically to define dominance of the circulation of the heart. Okay, so most of the people are right dominance. Okay, because the posterior descending comes usually from RCA, right coronary artery. Okay, okay. But anatomist define according where the SA node artery arise. Not that important. You should know the source of PDA is defined as dominance of the circulation of heart. Important. So now comes to the epicardial conductance vessel and septal perforator. This also comes from the LED, and these are the resistance vessel and play crucial role in oxygen and nutrient exchange, and they have rich capillary plexus. Okay, so that epicardial conductance vessel and septal perforator comes from LED, and these are the resistance vessel and play crucial role in oxygen and nutrient exchange. Now let's see this venous system. This vein is 3 number. Okay, 3 system. One is coronary sinus, second is right anterior right ventricular vein, and third one is Sabistion vein. Okay, so coronary sinus, it's predominantly drain the left ventricle. Okay, and receive 85% of the coronary venous blood. Okay, 85%. Okay, it lies within the posterior AV groove and empty into the right atrium. Okay, so it's empty into the right atrium. Okay, so finally this all the right atrium receive all the deoxygenated blood from the whole body. So remember, this coronary sinus also drain into the right atrium. It finally empty into the right atrium and drain the left ventricle. Okay, okay. And then right anterior right ventricular vein, it's present in right AV groove, and it forms the small cardiac vein. So they will ask, small cardiac veins comes from, so it's right anterior right ventricular vein. Okay, now come to the Sabistion vein. So it's directly drain into the cardiac chamber, okay, and exit primarily into the right side of the heart, either atrium or ventricle, okay. And the coronary sinus, you should know the anatomy of the coronary sinus for placement of retrograde cardioplegia cannula during CABG, cardiopulmonary bypass. So this retrograde is important. It's not for antegrade, it's a retrograde, okay, coronary sinus, okay. Now we'll see this table, very important table, okay. So the two main vessel, left main coronary artery and right coronary artery. So coronary artery, main arterial branch of the main artery supplying to the heart. So it is has two branch, left side is left main coronary artery and the right side is right coronary artery, or you can remove, just you can say left coronary artery and right coronary artery, okay. So this left main coronary artery divided has three branch, left anterior descending, circumflex coronary or ramus intermediate medius occasionally, okay. So now see the left anterior descending. So left anterior descending give the diagonal artery and septal perforation. This diagonal artery they ask most frequently, okay. Now come to the circumflex coronary. So circumflex coronary artery give the obtuse marginal branch and left posterior lateral artery. This obtuse word is important. So yeah, you can remember that circumflex is obtuse. Okay. Okay. And then right coronary artery give the acute marginal artery. So right is, so this is acute angle. Okay. So acute marginal artery comes from the right coronary, obtuse marginal artery comes from circumflex, okay. And other branch of right coronary artery is posterior descending artery. This is also very important, and right posterior lateral artery, okay. Thank you. Oh, I will explain this diagram further so that you can remember. So this is arch of aorta giving rise the right coronary artery and left main coronary artery. So this left main coronary artery further divide into circumflex artery and left anterior descending artery. Okay, left for anterior descending artery giving rise to the diagonal artery. Okay, okay. And this circumflex artery giving to the obtuse marginal artery. Okay, and now come to the right coronary artery giving rise to the acute marginal artery and posterior descending artery. Okay. I hope it's clear now. Thank you.